have TB treatment is quite difficult because there will be the second line TB drugs that mostly weak and toxic. Most of these drugs were developed decades ago but hardly ever used because of poor side effect profiles. Because of weak sterilizing activity of the second line TB drugs, MDR TB treatment generally takes 18 until 24 months. And Indonesia also has these 3 global high burden countries and listed for 2021 and 2025. And there are like 1 for TB, 1 for HIV associated with TB, and 1 for multi-drugs resistant TB. And as you can see that we also got from the data from WHO Global TB Report 2018. As we can see that there's some numbers here that show that there are TB cases in the world that we need to make that into a high issue. And as we can see that males here has more risk to get TB or tuberculosis. And TB case notification as well as here we can see that TB prevent treatment and also cases notified, total new and relapse, tested with rapid diagnostic at time of diagnostic. We can also see here, and we can also hear like TB preventive treatment in 2017. We also able to see here that even children also have the risk to get tuberculosis. And here is the data we have from Global TB Report from 2020 until 2022, the trend of estimated burden of TB in Indonesia from 2019 until 2021. Based on WHO estimation, Indonesia is ranked as the 2nd country with the highest TB burden. In 2021, TB incidence rate is 354 per 100,000 populations. TB incidence rate among HIV plus is 1%, 1 per 100,000 populations. DRTB, drug-resistant TB incidence rate is 10 per 100,000 populations. TB mortality rate is 52 per 100,000 population, and TB mortality rate among HIV plus is 2 per 100,000 populations. As you can see from the picture, is increasing, like the number of incident event mortality rate. This is in Indonesia. And as you can see that these are included in the SDGs or Sustainable Development Goals, as like number 3, good health and well-being is also connected to this issue in Indonesia. And also almost all these SDGs is affecting for this tuberculosis. Even number 1 is also like infecting or affect with the risk to get the tuberculosis. The World Health Organization developed a framework for monitoring of indicators in UN Sustainable Development Goals that are strongly associated with tuberculosis incidence. The TB SDGs monitoring framework comprises 14 indicators under 7 SDGs. For SDG number 3, the framework includes 7 indicators: coverage of essential health service and proportion of the population with large household expenditure on health as a share of total household expenditure or income, and then current health expenditure per capita, HIV prevalence of smoking, prevalence of diabetes, and prevalence of alcohol use disorder. And for SDGs number 1, 2, 7, 8, 10, and 11, maybe you can look at again, it's all over in Google, so you can search and you can see that the 7 indicators selected for monitoring are proportion of the population living below the international poverty line, proportion of the population covered by social protection floors or system, prevalence of undernourishment, proportion of the population with primary reliance on clean fuels and technology, GDP per capita, income inequality, and also urban population living in slums. And these are the symptoms of tuberculosis. If you can or able to find symptom of in a person like coughing up blood and then unintentional weight loss, night sweat, lost appetite, and then coughing that lasts 3 or more weeks. As you can, I searched in Indonesia, we have TOSS program in Indonesia to treat this TB. You can see the poster later on my last slide. And from that program, we try to introduce that if you find 14 days a person with coughing all the time, all day, and that is a symptom that you need to take immediately that person into a doctor to have check the health. And then chest pain and pain with breathing and coughing, and then fatigue and also chills. These are the symptoms of tuberculosis. If you find a person with these symptoms, maybe you can ask him or her to go to the doctor to have health check. And how to spread this TB. TB germs go into the air when someone who is sick with TB disease in the lung coughs, sneezes, speaks, or sings. People who are living, working, or spending a lot of time with this person share the same air. They can breathe in the TB germs and get infected with TB. And you cannot get TB from a person with latent TB infection. I'm sorry.
This video is presented by the Rutgers Global Tuberculosis Institute. The video explains how tuberculosis, or TB, is spread and what you can do to prevent it. Arun has just been diagnosed with TB disease. He has many questions, including, why did this happen to me? Did I make anyone else sick? How can I protect my friends and family? To answer these questions, let's first consider how TB germs spread. When a person has TB disease in their lungs or throat, they can release TB germs into the air when they cough, sneeze, sing, laugh, or speak. These germs are not visible with a naked eye and may remain floating in the air. If people breathe in those germs, they enter their lungs, which can become infected. This is most likely to happen if people spend a lot of time with someone who is sick with TB. Infection is less likely during short encounters, like when meeting someone while grocery shopping or mailing a letter. It's also less likely outdoors. Unlike the common cold, TB cannot spread by touching surfaces or other people, such as through handshakes, sharing utensils, or kissing. Once TB germs land on a surface, they cannot cause infection. Someone who has become infected may develop TB disease in their lungs or in other parts of their body, either soon after infection or years in the future. Most of the time, TB affects the lungs, but it can affect any part of the body. Disease in the lungs is called pulmonary TB. Disease in other parts of the body is called extrapulmonary TB. TB of the lungs is the type that is most likely to spread from person to person. Someone with a strong cough and with lots of TB germs in their lungs is more likely to spread TB to others. Adults are more likely to spread TB than children. People are more likely to be infected if they spend a lot of time in close contact with someone who has TB disease, such as family members, co-workers, or friends. People who have lived in or traveled to countries with higher rates of TB are more at risk for becoming infected with TB. Since TB is spread through the air, anyone can become infected with TB. A diagnosis does not mean that a person did anything wrong. It only means that they breathed in TB germs and became infected. Without treatment, they can go on to develop TB disease, like Arun, and spread TB to others. It is possible for someone to spread TB before they know that they are sick or are diagnosed with TB. This is why it's important for Arun to speak with the health department and share information about who he has spent time with while he was sick. This includes family members, friends, and co-workers. The health department will reach out to anyone who might have been exposed to TB germs so that they can be tested and treated. This is called a contact investigation. If someone has been infected, they can be treated to prevent them from becoming sick with TB disease. The health department will not share Arun's name or tell that he has TB. They will work as hard as they can to keep Arun and everyone else's personal information private. Arun may be feeling guilty about spreading TB to others, but he can help keep his family and friends healthy by talking with the health department. He can also share what he has learned about TB and urge his family and friends to ask questions to help ease their fears. What are some ways that Arun can take action now to reduce the chances of spreading TB to others, including his friends and family? When Arun is first starting his treatment, and before the medications have enough time to work, he may still be able to spread TB germs to others. This means that TB germs are still leaving his lungs when he coughs, sneezes, sings, laughs, or speaks. Until his body stops spreading TB germs, Arun should avoid spending time with others. If possible, he should sleep alone. These actions reduce the amount of time that others are exposed to the TB germs and makes it less likely they will become infected. Some patients who are very sick may need to be isolated in the hospital at the beginning of their treatment. When Arun does need to be near others, he should wear a mask. This reduces the amount of TB germs that enter the air and that can be breathed in by others. When he coughs or sneezes, he should cover his mouth with a disposable tissue. The tissue should not be reused. Fresh air from outside can also reduce the spread of TB by removing and scattering the TB germs. At home, this can include opening windows and doors for natural ventilation. TB is treatable and curable with the right medications. Arun's healthcare provider will discuss the best options for treating his TB. Most patients with TB will start feeling better early in their treatment and will be less likely to spread TB to others. A healthcare provider will perform tests to be sure. Even after he is no longer spreading TB, Arun needs to continue taking all of his medicine for the full length of his treatment. If he stops before his healthcare provider says it's okay, he may become sick and start spreading TB again. The health department can provide support to help Arun get through his treatment. Arun now feels more confident in his ability to protect others from being exposed to TB using isolation, masks, and ventilation. He will also follow his healthcare provider's advice to complete all of his treatment to help both himself and others. It can be scary to receive a diagnosis of TB. but it's important to know that TB is curable and that there are ways to avoid spreading it to others. Like Arun, you should be sure to share your questions and concerns so that your healthcare provider can help you with the information and care you need. For more information about TB, visit this website for the Centers for Disease Control and Prevention.
Okay. Sorry for the inconvenience. Okay, this is the different after we saw about how to spread the TB, and then is the characteristic person with latent TB infection and a person with TB disease. Active or inactive germ for latent TB has a small amount of TB germs in his or her body that are alive but inactive. And for TB disease has a large amount of active TB germs in his or her body. And then symptoms. Fortunately for latent has no symptoms, but for TB disease has so many symptoms that we have already seen in the previous slides. And then how about feeling sick? For TB disease usually feel sick. And also how to spread that might TB disease may spread TB bacteria to others. And then the test for TB latent TB usually has a skin test or blood test result indicating TB infection, and for TB disease usually has a skin test, the same. And then to follow up the test. For TB disease may have an abnormal chest X-ray or positive sputum smear or culture. And treatment for latent TB infection needs treatments for latent TB infection to prevent TB disease, and needs treatment to treat TB disease for TB disease. And here are the risk factors for tuberculosis. Someone who has immune compromises, and then substance abuse, and also like employment at a healthcare facility, homeless shelter, or prisons that have usually non-adherence to have treatment, and also travel to areas where TB is common, and also when you're living with someone infected with TB. And here's the treatment for latent TB infection. People with latent TB infection should take medicine to prevent the development of TB disease even though they don't feel sick. Treatment is highly recommended for people who have higher risk of developing TB disease once they have TB infection. This includes people with HIV infection, people who were recently exposed to someone with TB disease, usually like family among the person who has TB. And people with certain medical conditions such as substance user, diabetes, and some disease. Treatment for TB disease can pass TB germs. People with TB disease can pass TB germs to their family, friends, and others around them if they don't take TB medicine right away. And then people with TB disease need to take several medicines when they start treatment, and it has to be continuously. And then after taking TB medicine for several weeks, and most people take TB medicine for at least 6 months to be cured. A doctor will be able to tell TB patient when they are no longer able to spread TB germs to others, with some health checks, of course. And then people may undergo direct observation therapy or DOT to make sure that the medicine is being taken correctly and working effectively. And this is the program in Indonesia. We call it TOS TB. TOS is actually like has abbreviation in Indonesian. T for temukan, find, and temukan TBC, find TBC, obati, cure, sampai sembuh. SS itu cure until it's cured. And then we have one 14 days for having or knew or found a person with coughing in 14 days, and then one solution is take the person to the doctor. That is our program in Indonesia, and that also like having so many treatment after the doctor have the diagnosis. And finally, the most important is that encouragement community is about if we know about someone who get TB, or we know that anyone can get TB, but we have to make sure that TB is not a disease of the past. Disease can happen anywhere, everywhere to anyone. But latent TB infection can be treated, and we have to make sure as the support system that the person needs to get tested, and when you or someone have the risk and symptom of TB. And then ask the closest person to be the support system, good support system, to help to get the adherence of treatment continuously. I think that will be all. Thank you very much. Okay. Actually, it's almost it's over. But is there any question or comments? Maybe. Actually, I'm wondering about how in here, in Japan, maybe in other country, how to treat TB in your country. Anyway, share. You? Can you share? How about in Japan? Michael-san.
Have to get a state hospital, the isolated ward. Okay, I'm not a nurse, but I've been to the hospital for TB hospital. Well, I've never had a TB, but basically they send it to hospital in a separate ward from other patient. Yes.
For how long?
For how long?
I don't know, maybe nurses.
It's not common, right?
It's not common.
It's not common in
Because
here.
we usually have like
Vaccine.
Yeah, the vaccine. How about in Nepal?
First,
No? TB treatment.
there is a vaccine, yes, and the medication is also.
Maybe almost the same, huh?
Yeah, the medication is all countries must take it the same.
Same standard.
Have the same standard. But for us, we have a whole hospital, which before I came, it was in a very secluded area. But mom told me recently they moved to a nicer secluded area where it's next to the river and many trees. And we have many cases of multi-drug resistance. So that's right now is our main fight. And here you have the thing that says tos. Tos in Portuguese means cough. So yeah, I apologize.
Yeah, that's you. Thank you, thank you. Yeah. In medicine, absolutely must be has the same standard to treat tuberculosis. In my country, as what Yolanda said, most of people who infected, most of them is having MDR TB. Because of what? Because of the support system is not good enough. So they just like, okay, you have the medicine things, everything, just drink it, just take it, without any like, have you taken your medicine, something like that. It's a very small thing, but it's very important to have the support system for curing TB. So it's not about the disease, but about the community around the people who got TB. So we need that for this encouragement. I think that will be all. Is there any more comments, questions? Enough? Okay. Akosan, thank you very much, everyone. I'm sorry for all obstacles.